Welcome to RSCH503, Research Methods and Biostatistics, a 3-credit graduate course offered by Drexel University College of Nursing and Health Professions. The strength or validity of the best research evidence in nursing, as in all fields, is dependent on the quality and quantity of studies conducted. There are 7 levels of evidence upon which to base practice. Advanced practice registered nurses must seek out the best research evidence available in a clinical area to ensure high-quality care. The strongest evidence, that is, Level 1, comes from systematic reviews and meta-analyses of high-quality experimental studies, i.e. randomized controlled trials or RCTs. Level 2 includes evidence from an RCT or experimental study. Level 3 includes evidence from quasi-experimental studies. Level 4 includes evidence from non-experimental correlational and cohort studies. Level 5 includes evidence from mixed methods, systematic review, and qualitative meta-synthesis. Level 6 includes evidence from descriptive and correlational studies. The base of the evidence pyramid includes the weakest evidence, that is, evidence generated from opinions of expert committees and authorities not based on research findings. Evidence-based practice guidelines are rigorous, explicit clinical guidelines based on the best evidence available in a clinical area. Such guidelines provide the gold standard, that is, the standard of excellence for patient care, and providers are encouraged to incorporate them in their practice. Busy practitioners are assisted in making decisions about clinical care through the aid of evidence-based practice guidelines. Such guidelines are generally developed by panels of experts, including researchers, clinicians, and sometimes consumers, policymakers, and economists. In my nurse practitioner practice, these various practice guidelines are invaluable gold standards for the provision of high-quality care. The guidelines for management of hypertension and hypercholesterolemia, for example, have assisted me for years in caring for complex patients. The National Guidelines Clearinghouse is a major source for evidence-based clinical practice guidelines. Quantitative research methods involve 3 key essentials: rigor, generalizability, and control. Rigor in measurements and design, well-developed sampling plans that enable generalizations from sample findings to the population of interest, and control of extraneous variables. Study design achieves control. Tight control is achieved via experimental design, while only minimal or partial control is achieved with descriptive design. The use of random sampling ensures that the sample is representative of the population of interest. Non-random sampling or non-probability sampling invites loss of control and introduces the reality that the sample data may not represent the population. Once a random sample is chosen, it is also critical to prevent sample attrition, or the loss of subjects in the study. A study's setting must also be controlled. From a naturalistic setting, uncontrolled, to a more tightly controlled setting, such as is found in a clinical research center. Again, uncontrolled settings introduce extraneous variables that can influence findings. Lastly, the intervention must be precise, with strong reliability and validity evidence. All interventions must be used consistently, a phrase termed intervention fidelity. There are 2 types of study validity. Internal validity is the extent to which the effects detected in a study are true reflections of reality rather than being the result of extraneous variables. External validity is the extent to which the findings can be generalized to the population of interest. One famous threat to validity is termed the Hawthorne effect, or how subjects' knowledge of a study could influence their behavior and thus alter the study's outcomes. This became known as a possible threat to design validity through a study conducted at a Western Electric plant in the early 1930s. There are 12 steps in a quantitative research design, including recognition of a research problem and formulation of a research purpose, review of relevant literature, development of a framework, explication of assumptions, development of objectives, questions, or hypotheses, identification of study variables both conceptually and operationally, selection of a research design, definition of the population of interest and sample, methods of measurement of variables, plan for data collection and analysis, steps to implement the research plan, including possibly a pilot study, and a plan for communication of findings. Study variables must be defined both conceptually and operationally. Conceptual definitions provide theoretical meaning described in language, while operational definitions describe how a variable will be numerically measured. Quantitative studies require that variables be measured numerically in order for both descriptive and inferential statistics to be employed in analysis. Control is essential in quantitative research. Control exists on a continuum. From minimal control, as in descriptive research, to tight control, as in experimental research. In quantitative research, the goal is to infer findings obtained from a well-chosen sample that accurately reflects the population of interest, or generalization of sample findings to the population, termed external validity. Sampling plans are developed to ensure that the sample selected is representative of the population. In interpreting research findings, the researcher examines data analysis findings and takes time to fully understand the significance of those findings in light of study limitations, if such limitations exist. Study limitations decrease the external validity of a study. As you can see, the two ideas of internal validity and external validity are critical in reviewing research reports. With tight internal validity, but limited external validity, study findings may not be useful in practice. And again, sampling plans to ensure that sample subjects represent the population of interest must be well developed. It is always essential to remember that research does not lead to causality. Findings do not prove cause and effect. Rather, findings, even from RCTs, point to probable relationships, but not to cause and effect. Qualitative research, in contrast to quantitative research, is an approach to describe life experiences from the perspectives of those involved. Qualitative studies involve naturalistic settings and are often grounded in philosophical perspectives and inductive reasoning. Using open-ended methods, qualitative research does not have the controls used in quantitative studies. Thus, findings from qualitative studies describe only the sample subjects. Philosophy shapes the researcher's view of science, that in turn shapes that researcher's approaches and methods selected in designing research studies. There are 5 approaches to qualitative research. First, phenomenological, describing the experiences of phenomena as they are lived. Second, grounded theory, inductive technique that grounds findings in the concrete world experienced by subjects. Third, ethnography, reports of cultures from the perspective of insiders. Fourth, exploratory descriptive, identifying a specific lack of knowledge to be obtained from the viewpoints of the people most affected. And lastly, historical research that examines events of the past. This presentation was prepared for graduate nursing students at Drexel University College of Nursing and Health Professions. The primary book used in this research course is The Practice of Nursing Research, Appraisal, Synthesis, and Generation of Evidence, 2017, by Jennifer R. Gray, Susan K. Grove, and Suzanne Sutherland. This book is published by Elsevier Saunders, St. Louis, Missouri.